Iron infusion stain removal was very common in our practice. It's a very unfortunate situation what happens to people when they have this. They come along because they're iron deficient and they get told that there's numerous ways you can take iron. You can have it orally, or it's much easier to have an infusion. So to get an infusion, a cannula is injected into the vein in the elbow and the iron is slowly injected over a period of about 45 minutes. If where the cannula has been inserted is being misplaced, is not in the vein but is in the deep tissue, then the iron subsequently gets deposited through the whole subcutaneous tissue, and the resulting fact from that is a lot of pain at the site, and then the eventual progression of an extremely large amount of dark pigment throughout the elbow, forearm and arm. Often it even involves the nerves so that there's extreme sensitivity to even touching the skin. The worrying problem for me is that when this happens to clients, they're not told that there's an immediate treatment for this, but they can be treated with picosecond lasers. And the advantage of picosecond lasers is that it produces the best result. The most important issue is that you don't want to have this with you for the rest of your life, because what it means is it's never going to go away. And more importantly, you have to have some kind of garment to cover it all the time. And there's always that question from somebody else is, what happened to you? So we want you to know, if you come to Scars and Lasers, we can get on treat this immediately as soon as it happens, and we can make this problem go away, but it's going to take time. All we see when we see the skin is a dark pigmented area. It's like a tattoo. Now, whether the tattoo ink or whether the iron is injected superficially or deep is going to depend on how many treatments we need. The more superficial, the better the response. Management is a key issue here. How many treatments is a patient going to require? And when it comes to your first treatment, you're going to look pretty good, but with multiple treatments, we'll rid ourselves of the top layer of the skin where the pigment is, and then we're left with the deeper pigment, which is harder to treat, requires higher energies. The message is, if you need to have your problem treated, picosecond laser is the way to treat it. We're available to treat this. As soon as this unfortunate event happens, contact us immediately and we'll work through this with you. We'll need a consultation, then we can work out a treatment plan. We'll either get total or partial removal of your pigment. In some cases, this may be covered by accident compensation, and we can discuss this with you and then work forward with ACC to allow you to have reduction of your pigment.